Okay, everyone, good evening. And today is our August Grant webinar where we'll be talking on understanding your breast cancer diagnosis with our doctor, Dr. Theophilus. And it's going to be an interesting one because we understand that when it comes to breast cancer, there are a lot of uncertain things about it. There's a lot of confusion and there's a lot of anxiety with it. What exactly is breast cancer and what does one do about it? And so at the end of this webinar, you're going to be learning a lot. And so I would encourage you to listen closely because there's a lot you can learn from it. And to open this webinar, I will welcome you all and I hope that you would enjoy the webinar. I will now be handing over to my colleague, Elizabeth, to take us on the icebreaker question.
Good evening, everyone. Has been your day today? So I'll be asking two questions. First question is, what is your go-to self-care activity to reduce stress? What's the activity that you always do when you feel stressed or when you are stressed? You can please type in your answers in the chat box before we go to the second question. Modipe says sleeping. Interesting. For me, it's just to listen to music. I just love to plug my ears and just be on my own when I'm stressed. Any other answer? We don't have a lot of time to dwell on this first question. Seeing movies, sleeping. Deborah, thank you for contributing. Okay, one more minute before we go to the next question. So we have sleeping. I think sleeping takes the highest votes. Sleeping as well, okay. So most people love sleeping when they're stressed. Thank you for contributing. Let's go to the second icebreaker question. What do you hope to learn or take away from today's discussion? I'm sure you attending this webinar today, you have things you hope to get or information or questions you hope to get answered in this webinar. So you can just type in your expectations for this webinar, what you think you really want to take away from this webinar. We have 1 minute to type in our answers. What do you hope to learn from this webinar today? I hope to know what types of tests one can do to know if one has breast cancer. Thank you very much, Dupe, for that contribution. Understand subtle signs of breast cancer. Yes, this is very, very important. This information is what we can even tailor around people, our neighbors, our family members. We can also educate them. So having this information is very, very important. Why do people get cancer? I think that's a very controversial expectation. Well, the doctors, they will shed more light on that. Thank you very much. Does any other person have an expectation to share before we move on to the next item on the agenda? Okay. So in the absence of no more answers, thank you very much. Okay, someone just to get enlightened on how to manage cancer treatments. Yes, very, very important. Thank you, Blessing. So thank you very much, time, and thank you for contributing. I would be handing over to Ruth, who will be taking the introduction of our speaker today. Thank you and enjoy the rest of today's webinar.
Okay, thank you, Elizabeth. Good evening, everyone. So my name is Ruth, and I'll be introducing our speaker for today. So the speaker for today is Dr. Theophilus Sauch. Is a dedicated medical doctor with a strong interest in cancer care and public health. He earned his MBBS from the University of Lagos and is fully registered with the Medical and Dental Council of Nigeria and GMC UK. Over the years, he has gained practical experience in oncology and continues to support patients through hands-on clinical care, cancer awareness campaigns, and multidisciplinary teams. Currently pursuing a master's in public health at Ahmadu Bello University, Zaria. His studies focus on areas like epidemiology, health education, and public health surveillance. His goal is to bridge the gap between clinical cancer care and community health, especially in low-resource settings. As part of the BRANDS program, he helps deliver clear, reliable cancer information to patients and caregivers, promoting early detection and informed care decisions. Outside of work, he enjoys spending time with his family and is always open to learning and growth. Help me welcome Dr. Theophilus Hauge, our speaker. Thank you.
Good afternoon, everyone. Please, I just want to be sure that you can hear me or see my video. You can just respond with an emoji if you can see me clearly and hear me very well. All right. You can see Elizabeth. You can see Modupe. So thank you very much. Thank you, everyone. Okay. So if you're happy to be present at this webinar today, can you just put an emoji on the group? Just maybe put an emoji on the chat box rather. Okay, so I can see the slide is up. Please, can you go to the first slide? The first, okay. So my name is Dr. Saoje Theophilus. You can see I'm a young person. Don't mind those plain things that were being said at the introduction. And I have a very strong interest in breast cancer, as was mentioned. Please move to the next slide. Okay, so first and foremost, I want to appreciate everybody here. I want to appreciate Modupe. I want to appreciate Ruth, Deborah, Elizabeth for putting together this webinar and also for inviting me to speak on this webinar. And also to appreciate our superiors, who, even though they are not currently here present, Dr. Salako, Dr. Adora, for this opportunity. It's not one I take for granted at all. And I also want to appreciate all of our all of our grant patients and our carers who are currently on this webinar. I really appreciate for the carers, I appreciate the work you're doing. For the patients, I appreciate the fact that you came here to learn more about this. So we hope that at the end of this webinar, we'll be able to answer whatever questions that you might have, because we know that cancer journey, even as a patient or a carer, is not an easy journey. It's a journey whereby you need as much information as possible. You need as much support as possible, and we'll do everything possible to provide this information and support to you. Okay, so I will start with the previous slide. So I'll start with our mission. So at PEARL, CoBrand is a program that came out of PEARL Oncology and OncoPADI. So our mission is, through our chain of cancer centers, research, education, and technology, our mission is to prevent, treat, cure, and palliate cancer while advancing calm, clarity, and hope in every patient interaction. I intentionally highlighted the calm and the clarity part because, as much as possible, I want everyone that attends this webinar to calmly, I would like to pass the information in a very calm way, as calm as possible, and I want everyone to have a very clear idea of exactly what we are dealing with. Okay, so the aim here is so that you can appreciate your breast cancer diagnosis, both the histology, the staging, and the various tests and treatment modalities that you are currently undergoing or your loved one is undergoing, so that this is to help you feel more in control of your journey. The next slide, please. Okay, so I chose to do this as a case study. So case study is in medical school or in clinical medicine. Case study is when you just use someone as an example. Mrs. AA is not anybody. It's just a fictional name. It's an abbreviation. So just assume a patient, Mrs. AA, she's age 40. She was recently told that she had stage 3 ER positive, PR positive, HER2 negative left breast cancer, and she has done an histology. Histology is a test that we do on the breast tissue. She has done an histology following a surgery, a mastectomy, which is the removal of the breast, of the entire breast, basically. So the histology revealed that she had residual invasive carcinoma, NST, with DCIS. All this seems like jargons, but I try to put myself in the shoe of a patient who has been told this. You came to the hospital, they've asked you questions, and you've been told, oh, this is what you have. And oh, this was the result of your histology. This was the result of your other test. So this seems like a lot of jargons. So I hope that at the end of this, they will be able to understand what each of this is, and also to understand what breast cancer is, the risk factors of breast cancer, to understand what the symptoms are, the various staging, and the various treatment modalities and investigations. Please, the next slide. Okay, so this is the outline we'll be working with today. We'll be defining breast cancer. We'll be talking about the causes and the risk factors. We'll be talking about the symptoms and the signs. We'll talk about the investigation, under which we'll discuss the staging. Then there's a particular test we do, which we call the IHC, which on the basis of the IHC, that is where we actually have our branch program. We'll be discussing the IHC and what the IHC actually helps us to achieve regarding the cancer care. Okay, so breast, what is breast? I think anybody can, I'm sure anybody can actually point, but if I don't know if there's somebody who, okay. The answer is there. Please, can you take away this slide? Go to the previous one. Okay, can someone just attempt what breast is in layman language? Does anybody want to try? Okay, the chest. Okay, any other response? Okay, so that's a very good attempt. So let's go to the next slide. Let's break it down. So basically, breast is a glandular, it's an organ which is located on the chest. And as far as we are concerned, the major role of breast is in milk production in female. And this is because it contains a gland that helps in the production of milk. Of course, there will be other functions of the breast, but this is the most basic function that we all know of. And so breast is mostly prominent in females, but it doesn't mean that males don't have breast. You get, as a matter of fact, there are even some males that their breast is bigger than those of females, but I don't think that's the discussion for today. So males have breast basically, but it's usually more developed and prominent in females. And of course, it doesn't serve the same function like in male and female. So I want us to try and look at this image. It's to be very important. It's to be a foundation for other things we are going to be discussing today. So this is the anatomy of the breast. Anatomy just means that these are the things that make up the breast itself. what we see from outside is the muscle itself, but in the inside of the breast, so this is the chest wall. Chest wall just refers to the bone. These are the ribs. So in between the ribs, there are muscles on which the breast tissue itself lies. So the highest percentage of the breast is actually made up of fatty tissue. That is the yellow substance we can see around. Then within the fatty tissue, we have some circular structures, which we call the lobes. Then those circular structures, they have something like a thin pipe that connects the circular structures towards the nipple. We call those structures the ducts. So these lobes and are we together, please? Please, are we together? All right.
Yes.
So these lobes and the ducts together form what we call the glandular layer of the breast. So these lobes and the ducts, then we have the fatty tissue, like I said. Then of course, we now have in the external part, we have the skin that covers all these things, and we have the nipple. Then we have the areola. The areola is basically that black structure that surrounds the nipple. Then another important thing we should note is that there are some things we call lymph nodes in our body. We have lymph nodes all around our body. They are just small circular structures that help us to transmit a particular liquid, which helps our body to fight against infection. Ordinarily, lymph nodes are not something that we expect to be able to feel. We normally don't feel lymph nodes. We begin to feel lymph nodes if there are infections going on in the body, or if there are if there's infection in the body, or if there's some changes going on in the body, such as cancer. Yeah, so if there's any form of cancerous changes going on in the body, we might begin to feel lymph nodes. So we have some lymph nodes around the breast, which also move to the armpits, towards the armpits. So the next slide. Okay, so what then is breast cancer? So breast cancer is basically when abnormal cells in the breast begin to grow and divide in an uncontrolled way and eventually form a tumor. Did we get that? So we'll find out now, we'll find out on the previous slide what can be the things that can cause those abnormal cells. So abnormal cells could, some of these breast cells itself could just become abnormal, and then it begins to grow in an uncontrolled way and eventually form a tumor. Breast cancer happens to be the most diagnosed cancer in women. About 1 in 8 women have breast cancer. And it's also 1 in 1,000 men have breast cancer. Okay, so from this image here, this is the area I called the lobe of the breast. And this is basically a growth around that lobe. So this is basically a tumor that must have developed from an abnormal cell. Please, are we together? Okay. Okay, so that is one. Then I want to use, since I just spoke about the anatomy, I want to progress into the different types of breast cancer. In the Browns program, please still go to the previous slide. In the Browns program, what we do is that we take, one of the major tests we do is a biopsy. Biopsy is basically when they take a sample of the breast cell, of this kind of abnormal breast cell, and they will go to test it in the lab and find out some properties about that breast cell. Okay, so I've seen a lot of histology results. Most times we do a test we call IHC for patients who have undergone an histology. And when I see most of the histology results, I see, okay, the right invasive ductal carcinoma. You see something like some of them, you see lobular carcinoma in situ, ductal carcinoma in situ. So what exactly is those ductal carcinoma in situ and invasive lobular carcinoma? this is what this image is going to explain to us. So one way we can divide cancer, some different types of cancer. Cancer can be non-invasive or invasive. Are we together? So invasive is an English word. Invasive means that you have been able to occupy a particular place. You've been able to occupy the whole of a particular area. So non-invasive means that you are basically limited to one particular spot. Okay. So this image, already told us from the anatomy that we have the lobes, then we have the tubes that link from the lobe, which we call the dots. So abnormal cancer cells can actually develop anywhere in the breast. But usually when they develop within these lobes, within these round circular structures, and if the abnormal cells are confined within this particular round circular structure, we call it in situ. In sight, basically, in sight. Then because it's within the lobe itself, we now call it lobular carcinoma. Carcinoma just simply means cancer. Lobular just means this structure, which we call the lobe. So lobular carcinoma in situ means that the cancer cells are within the confines of this lobe. That is just what it means. It has not yet gone out of that lobe. Then we'll describe it as an invasive lobular carcinoma if we see that the cancer cells have spread beyond this lobe. It has spread out. So if you see an histology result and you see something of that nature, this is basically what they are describing for you. Here's the next slide. So the same thing with the duct. From the anatomy I described, I said we have the lobe, then we have the dot. It's the dot that links to the nipple. Basically, the dot carries the milks are produced in the lobe, and the dot transports them towards the nipple of the woman. So if abnormal cancer cells develop within this milk dot, we call it ductal carcinoma. As the name implies, ductal carcinoma just simply means cancer within the duct. Okay, it's cancer within the duct. In situ just basically means in sight. It's confined within the duct. Then it becomes invasive if those abnormal cancer cells begin to spread outside of the duct and they start spreading to the fatty tissue that are within the breast. So that is why we call it invasive. So if you see an histology report that shows that you have invasive ductal carcinoma, this just means that it has spread within the duct of the breast and it has spread to the other surrounding fats and structures within the breast itself. But if you see this, it means that you still have cancer, but it's still very, very confined within the duct of the breast itself. I don't know if that's clear. Please, if it's clear, I want you to just put an emoji on the chat box for me to be sure that that's clear. So the next one we'll be discussing is the risk factors. So I know one common question people ask is, oh, why did I have cancer? What's the cause of cancer? So the truth is, there's usually no clear-cut cause of cancer. There's nothing you can point at, oh, this was what caused my breast cancer. Oh, this was a particular thing that caused my breast cancer. But there's what we call risk factors. Risk factors is just, in simple terms, risk factors there are some things that make you more likely to have breast cancer. So that is basically risk factors. For example, one of the risk factors, one of the things that can make you likely to have cancer is age, older age, especially if you're over 50. That just means that if you see a 25-year-old lady and you see a 55-year-old woman, there's a high chance of the 55-year-old person having breast cancer. It doesn't mean that there are no young people that have breast cancer. But if you see 10 people who have breast cancer, there's a high chance that 8 of them will be over 50. Maybe 2 of them will be younger people. That is just the meaning of risk factors. So one of the common risk factors is age over 50. Then female. like I spoke in the introductory parts, males also have breast, but it's usually more developed in female. They are the ones who have the lobes, the ducts, and the likes in the breast. So it's common in female. Then it's common in those who have a dense breast. So what does dense mean? Dense just means like it's a relatively thick breast. And why is having a dense breast increase your likelihood of having a breast cancer? Number one is because if the breast muscle is thick, it means that if you go for a scan, it might not be very easy to pick out if there are cancer cells developing, especially if it hasn't yet spread a whole lot in the breast. So that is one of what makes having a dense breast a bit of a risk factor. There are other theories that give some reasons, but I will just leave it at that for now. Okay, then the other risk factor is genetics. So those who have a family history of breast cancer or ovarian cancer, they are more likely to have breast cancer. That is why most times when you come to the clinic, we ask, is there any family history of breast cancer? Because there's a particular gene we call the BRCA1 and 2 gene that is usually present in families, and such that if you have that gene, there will be a likelihood of you having breast cancer. So family history, basically. There are some lifestyle factors that also increases your risk of having breast cancer, of which we have diets, alcohol, obesity, reproductive factors like early menstruation. If you start seeing your period at an earlier age, say you start seeing your period from 10 years old, what this means is that, I will explain this, or you'll stop seeing your period at a late age. There are persons who stop, the average age am I too fast?
No, but your line broke a bit. Could you just go over the last thing you said, Dr. Theo?
Okay. So I spoke about the reproductive factors that also increases the likelihood of having breast cancer. So one of which is early menstruation. Women who start seeing their period at an earlier age, then late menopause, women who stop seeing their period well after the age of 50, because 50 years is like the average age of menopause, around 50, just before 50 or just after 50. But some people still see their period as much as late as 60 years. So that is late menopause. Why? Is because there are hormones in our body that control menstruation. So if you start seeing your period very early, it means that your body is already activating this particular hormone way earlier than other people. Then if you stop seeing your period way after 50, it means that even when other people have stopped their period, your body is still having high levels of these hormones. And the presence of those hormones, estrogen, hormones are basically like protein. Hormones are things that regulate the functions of our body. So they are like proteins in our body that coordinate menstruation, they coordinate pregnancy, coordinate breastfeeding. So your body being exposed to this high level of hormones way after 50 also increases your likelihood of having breast cancer. Also, another risk factor is lack of breastfeeding. So basically, it's the same thing. So when you breastfeed, when you have a child, there's high levels of prolactin and certain hormones in your body. But when you breastfeed, your body is able to regulate these hormones. But when you don't breastfeed, there are high levels of the hormones in your body, which also increases your risk of breast cancer. Then another risk factor is oral contraceptive pills or hormone replacement therapy. So oral contraceptive pills it's usually what we use for family planning. It's one of the means of family planning, basically. So oral contraceptive pills also contain hormones, estrogen, progesterone. So when you take these pills, you're basically taking extra of these hormones. Normally your body makes them, but you're taking extra. So using pills, oral contraceptive pills, also increases your likelihood of breast cancer. Then same thing with nulliparity. Nulliparity is basically a woman who has not had a child before. So women who have not had, so there's a picture here. You could just be glancing through this picture even while I'm explaining. So women who have not had a child before, or a woman who gives birth to her first child after the age of 30, they also have a higher risk of breast cancer. I don't know if that's clear. Okay. If we have any questions, please just note them. We'll ask them after. So the symptoms of breast cancer, the common symptom of which most people experience is lump or a swelling in the breast, chest, or armpit. But I've seen cases where the first symptom that this person experienced was she does notice that there was a change in the color of her breast. So that was the first symptom this person experienced. There was no lump, there was no pain. It was just a change in the color of the breast. That was the first symptom. So, but though the commonest symptom that most people come down with is a lump or a swelling in the breast or chest or armpit. But then I want to add a disclaimer here that not every lump or swelling in the breast automatically means it's breast cancer. There's a particular kind of lump that we see in young people, in young females, especially in their early 20s to early 30s. It's usually it's an innocent lump. So it's an innocent lump such that it doesn't have a tendency to grow or increase in size. But also there are lumps that come and they have a tendency to grow and increase in size. So usually you won't know which lump is innocent or which lump is malicious unless you go further to do tests. Okay, so the other symptoms we have are, okay, I already mentioned the change in the skin. This is a situation whereby you notice the skin looking like an orange. So it looks like an orange, or the skin of the breast may look red. Then there could also be a change in the shape or size of one or both breasts. Then you could also have nipple discharge. We expect a woman who is breastfeeding to have some discharge from the nipple. But if you are not breastfeeding, you're not pregnant, and you're not seeing nipple discharge, then that is a red flag. You need to have your breast checked. Or the discharge may not even be milky. It may be blood, basically. Then there could also be a change in the shape or the look of the nipple, such as the nipple begins to turn inwards. Normal nipple should be pointing outwards, but if you notice your nipple starts turning inwards, that could be a sign also. Then there are other signs that's, okay, then persistent pain in the breast or in the armpits. It's kind of normal for some women to experience some pain, which will come and go during their period or just before their period. But if for some reason you are experiencing pain that just seems to not be going anywhere, this pain is just there, day in, day out, consistently, then that is a red flag. You need to have your breast checked. Then there are other symptoms like losing weight unintentionally, poor appetite, night sweats, or fever. Here's the next slide. Okay, so I want to talk about self-examination of the breast. So why is self-examination of the breast important? Self-examination of the breast is important because if you regularly examine your breast, it means that you will have an idea how your breast feels. And if you notice anything abnormal, it will be easy for you to pick it up that, oh, I checked yesterday, I didn't notice this, but this morning I'm noticing this swelling here. So you can then go to the hospital and have it checked. So how do we do a self-breast examination? You can do this in the bedroom when you're having your bath. You stand in front of the mirror, you raise your hand up, you examine your armpit, you squeeze your nipple. Basically, you're checking if there's any discharge. Then in a circular fashion, you can massage around the breast, both from upwards, downwards. You could also do this while lying down in bed, such that if you notice any abnormal lump or swelling, the next slide. So if you notice any abnormal lump or swelling, what you should do next is to see a doctor. Please go and see a doctor. Don't go and ask your neighbor. Don't ask Mama Nkechi or ask Papa. Don't ask anybody, because if you start asking people, that is when there's a chance you start getting wrong advice. That, oh, they also had similar thing. So you should see a doctor. You see a doctor, the doctor will ask you questions, the doctor will examine you. And most likely after that, the doctor will send you to do an ultrasound of your breast. That is basically a scan of your breast or a mammogram. Usually we do ultrasound for people who are less than 40 years. We do mammogram for those who are greater than 40 years. And that is because of the difference in the density of their breast. Because people who are more than 40 years, their breasts tend to be more dense. So mammogram is able to see through the breast and give us a more accurate picture of what's going on there. So following an ultrasound of the breast, the next test we usually do is what we call a biopsy. So biopsy is a test whereby we take a needle and we pierce it through your breast to take a sample of the abnormal cells or a sample of the cells, because at this point we are not sure if the cells are abnormal or they are not, if they are cancerous or not. So we take a sample of the breast cells to confirm if they are cancerous or not. That is the only way we can actually confirm if anyone has breast cancer or not. Then the other tests that we can do include imaging. So imaging is basically an advanced CT scan. It's basically a scan where you go into, there are different types of imaging, but what we prefer usually is what we call a CT scan of the chest and the abdomen. So it's a test where you are put into a machine, and the machine scans your chest, the entire breast, and also your tummy to see if it can help us to check if the cancer by any chance has spread to any other parts of the body. And also to help us to clearly visualize the location of the cancer. Then there are other higher imaging tests like a PET scan. This basically scans your entire body. There's also MRI scan. Okay, so then we do some blood tests, basically checking your kidney, your liver, your blood count. Other tests we do are to check for this abnormal gene, which we call the BRCA gene. Then there's also what we call a tumor marker. There are some proteins in the body that becomes very, very elevated in the presence of cancer cells. So this is what we call CA125, CA15-3. Then we also do what we call an IHC. So for staging of breast cancer, the next slide, please. So like I described earlier, stage 0 breast cancer is the type which is still within the duct or within the lobe. Then stage 1 breast cancer is a cancer that has begun to develop, and it's usually less than 2 centimeters, and it has begun to, Then stage 2 breast cancer, it's a bit much bigger. It's usually within 2 to 5 cm. Then the stage 3 breast cancer is the one that has spread beyond the breast and has not spread to the armpits, and basically it has spread and covered the whole of the breast tissue and also spread to the armpits. Stage 4 breast cancer is what we call a metastatic breast cancer, which has spread beyond the breast and to other organs in the body, like the liver, the lungs. Please, the next slide. So this is basically a summary of the staging of the breast cancer. So this is basically a summary of the staging of the breast cancer I mentioned earlier. Okay, the next slide, please. Okay. So what we do at Brand Program usually is to take the breast tissue, put some particular chemicals in the breast tissue, and see if there are some particular proteins that are present on that breast tissue. Or proteins, or we call them hormones. The proteins we usually check, the hormones we usually check for estrogen, progesterone, and HER2. So based on these 3 hormones, there are different names there are different types of breast cancer. There are different types of breast cancer we also have based on that test. which these are the Illumina A, B, HER2, and triple negative. So I will use this slide to just explain it so that we can move ahead. So if there's a presence of this hormone ER in your breast tissue, we tell you that you have a Illumina A breast cancer. This is usually the one that has usually the most favorable outcome. Usually have the best outcome. Then there's also what we call the Illumina B. Okay, it's similar to A, but it usually has a worse outcome compared to A. Then there's also what we call the HER2 negative. Anyone who has actually had their IHC results. So if there's no ER hormone present, there's no PR hormone present, but there's this hormone present, we tell you that you have a HER2 positive breast cancer. Then there's also the type of breast cancer whereby these three hormones are negative. ER is negative, PR is negative, HER2 is negative. So that's what we call the triple negative breast cancer. And this usually has the worst outcome out of all of them, if not properly managed. Please, the next slide. Okay, so this is basically what I just described. Okay, please let's go to the next slide. Okay. So this is what I described just now. So what are the common treatments for breast cancer? So I want you to know, it's very important to know that the treatment of breast cancer is multidisciplinary. What does this mean? It means that there are different specialists that come together to manage breast cancer usually. So we have the oncologists who are the breast cancer specialists. They could also have the surgeons in case you need to undergo surgery. Then for patients who might also have some conditions like hypertension, diabetes, then we also have the family physician who will come in to help you take care of those. So the common treatment we have for breast cancer includes surgery. Surgery could just either be a lumpectomy, whereby we are just removing the lump, or a mastectomy. Mastectomy is where we remove the entire breast itself. There could also be chemotherapy, which is basically you getting anti-cancer medication through a drip, basically. Then there's radiation therapy. This is where we use heat radiation to kill the cancer cells. Then there's hormonal therapy. Hormonal therapy usually will be based on the results we get from the IHC I just described earlier. Then there's also targeted therapy. It's usually for those who come out with HER2 positive breast cancer. Then there's immunotherapy. Then there's then it's usually not a one-off. If there are patients who will first undergo surgery, then they will have chemotherapy. Thereafter, they will have radiation therapy, and they could also get hormone therapy. So it depends. So it's not like if you get chemotherapy, you won't undergo surgery also. There are those who will first get chemotherapy to shrink the cancer cells. Thereafter, they will undergo surgery and radiation therapy. So there could be a combination of all these treatments. Of course, we expect some side effects based on these treatments, but we are usually there to provide support as much as possible during your treatment. And we have an app that actually helps us to achieve this, which we call the ProScare app. Please let's move to the next slide. Okay, then for those living with breast cancer, we cannot completely understand what you are going through. That's the truth. But we are aware that cancer it usually has a very emotional impact on both the patients and the carers. So we are usually able to provide you. They usually need emotional and mental health support. We actually have a psychologist who help you with that. And there's also a need for nutritional support and physical activity. And there are also support groups. There's also the need for support groups and community resource, whereby you interact with other carers and other patients. Here's the next slide. And I also want to talk about some common misconceptions that people have about breast cancer. One of which is that some supplements can cure breast cancer. And I added this specifically because I've had interactions with a patient. Let me give you some scenario. I know a particular patient who earlier on she had a scan which detected that okay, she had a lump, and she was told to undergo a surgery, but she met some other persons who advised her that there are some supplements that she can use to take care of this breast cancer. She used supplement for about 2 years. Within that period of 2 years, this cancer became worse and it spread to other parts of the body. It basically became a stage 4 cancer. So please, there's no single supplement I know of that can help you treat breast cancer. So that is a misconception. People who do that most times, they just want to take your money. Then there's also this one of that men cannot get breast cancer. That is a lie. The fact that men have breasts, it means that they can also get breast cancer, though it just happens to be more common in women. Then that breast cancer cannot be cured. That is also false, because if you catch it at a very early stage, you can actually cure it. Then I came across this recently, that chemotherapy is delivered by a huge machine. This is also false. Chemotherapy is just basically you getting drip. Drip is what many of us get in our various hospitals when we go to treat malaria. So it's basically we're putting the cancer medication into the drip. Okay, so I'm rounding up. I think I'm almost done. So I just want to let us know this. Number one, early detection saves lives. And also to know that treatment options are improving every year. And I think currently we have immunotherapy, which we are also using for many of our patients. And also to encourage everyone here that there's a life after a breast cancer diagnosis. Breast cancer is basically a chapter. It's just a chapter in your life. It's not the entire book. So it's a chapter it's a journey that you can actually go through and close that chapter, and you move on with every other thing in your life. Then there's a need to ensure regular checkups and communication with your healthcare providers. The next slide. So thank you very much.
Thank you so much, Dr. Theophilus. Really appreciate this insightful session. Thank you so much. Please, can we see our reaction in the chat box? Please, can you send your reaction? Just say thank you to Dr. Theophilus for that very brilliant and insightful session. Thank you so much as your comments and your reactions are coming in. And I must say, Dr. Theophilus, that this session has taught me a lot about cancer, especially when you were talking about the histology results and how patients can understand what they are seeing. You know, it goes a long way when a patient understands what they are seeing, what they are hearing. It goes a long way than for them to just be in the dark and not understanding, going to doctor's consultation and, you know, just looking blank. And I believe this has empowered someone today, and this empowerment will go on to empower another person that is not even here today. Because one thing I've know with breast cancer and staying with patients with breast cancer is that we spread the word, we spread the message. We don't just allow the disease to continue to go on and, you know, affect people and keep people in the dark. We also spread the word and spread the message. So I'm using this opportunity to wait for our questions in the chat box. Please, if you have questions from this session, kindly send it into the chat box. So without wasting much of our time, we have some questions here from our patients prior to this session. And number one says that, is it safe to do chemotherapy? Dr. Theophilus has answered it, but I just want him to shed more light. He said something about chemotherapy. So Dr. Theophilus, please, can you shed more light into it? Is it safe for is chemotherapy safe?
Okay, so thank you for the question. So chemotherapy is actually very safe, but usually before our patients undergo chemotherapy, we send them to do some routine tests whereby we check their organs to be sure that they're actually adequate enough to withstand the effects of chemotherapy. Usually we check their kidney function, check their liver function, we check their blood counts, such that if there's any abnormality, we ensure that we correct it first to ensure that to put the patient in the best possible state to receive chemotherapy. Though it comes with effects, we are usually able to manage them also. Thank you.
Thank you so much for that. So chemotherapy is safe, and the healthcare team, they put all the measures. They make sure they follow all the measures before putting someone on chemotherapy, and that this speaks a lot to please go to a very good facility for your treatment, for your care plan. Go listen to your doctors when they are saying something to you. So the second question here says, if someone in my family has breast cancer, does that mean I will have it? That's the next question, doctor.
Okay. So if someone in your family has breast cancer, it doesn't automatically mean that you will have it. But it will be wise for you to, it will be important for you to actually screen if you have the presence of that particular gene that causes breast cancer, I mentioned it here, the BRCA gene. And you can also do a regular ultrasound, depends on your age, just to be sure that you are checking up yourself just in case. But it doesn't automatically mean that you will have breast cancer. But there's a chance you might have it, but it's not 100%, basically.
Okay, thank you so much, Dr. Theophilus, for that. That's brilliant. I believe that person has had this questions answered. And I have one more question, and it's in the chat box. It says, does having pain in both breasts that persists for 3 days now, 9 days after her period, persistent headache, tingling in left arm and leg, back pain, and tastelessness in mouth point to breast cancer? So this is a patient, this is someone having some series of symptoms concerning their breast. So they want you to help them debunk if these symptoms are symptoms that point to breast cancer.
So thank you so much, Elizabeth, for the question. So the symptoms you mentioned now, pain in both breasts, persists for 3 days, it doesn't exactly point to breast cancer. When some women experience what we call premenstrual symptoms, and it can be different. Some people feel pain in their breasts. Some even have headache. Some have rash just before their menses. And for some, it persists even during the menses and after the menses. Then thereafter, it goes and it comes back again. So this doesn't really tell us that you have breast cancer. But it's important for you to still have it checked if things like this, if the pain persists for a very long time, it's important for you to have it checked.
Thank you so much, doctor, for that. And I believe that's clear, Elizabeth. So please, it's important for you to see your doctor, important for you to go into the hospital to have yourself checked. Although breast cancer is one thing, there are many other diseases out there that this may also be a symptom of. So thank you for that question. So before I hand over to Modupe, I want to say thank you for attending today's session. And thank you for the insightful questions and the answers from Dr. Theophilus. And now a word to breast cancer patients. Breast cancer is not the end of the world. There's still more to do. There are more people and more lives to impact through your journey. So your story counts. Your story will go a long way to encourage people, and the fact that you're alive, you're standing, and you are going through this journey means that you are strong and that you're a survivor. So my kudos to you and my love to all the patients and caregivers. Thank you so much. Modupe, over to you.
Thank you very much, Deborah, for sharing those words. And for those on the call, I want to say a big thank you for attending today's webinar. The reason behind this webinar was to better understand breast cancer diagnosis. And I hope that at the end of the webinar, you have gained some information, no matter how little. And don't keep it to yourself. Share it with another woman today. And I also encourage us to please follow us on our social media platforms, on Instagram at Uncle Paddy App and LinkedIn at Uncle Paddy Tech. And lastly, I would say that the brand program is here to support women with breast cancer. We're not just limited to which is why this webinar is here. This webinar is for every woman to gain more information that she can share with another woman, and also to tell other women about the brand program and how it provides a lot of services, as was mentioned earlier, speaking with the psychologist, speaking with the dietitian. There is so much that can be done, and we're here to support you. Thank you so much, everyone. I wish us a lovely evening and a great week ahead. Bye-bye, everyone.
Thank you. Bye.
Bye.